There are a lot of provisions in this bill. It's very comprehensive, but it will do a lot of things to knock down Obamacare. It's going to change the subsidies that Obamacare now provides to help people pay their premiums. Those subsidies are now based on a person's income and, very importantly, on the cost of the premium in their area. The Republican plan will offer instead tax credits based on a person's age, and this could be a really big problem for people because if the cost of coverage in their area is very high, the tax credits don't adjust like the Obamacare subsidies do to cover that. Another big change that the Republican plan would enact is that right now there are ironclad protections for people with pre-existing conditions under Obamacare. The Republican plan would allow states to waive out of some of those provisions. So insurers could charge people more based on their health history, and they could also not cover all of the treatments and services that some people with pre-existing conditions need. So Republicans, instead of offering these benefits for people with pre-existing conditions, they're going to bring back high-risk pools, which were very common before Obamacare. But they were expensive. They charged oftentimes double the premiums. These high-risk pools in the past, before Obamacare, were chronically underfunded, and states had to put in billions of dollars in order to, make them solvent. So the high-risk pools are going to be a very expensive option. So insurers under Obamacare are required to cover 10 essential health benefits. These include prescription drugs, substance abuse, mental health, maternity. Under the Republican plan, states can opt out of requiring insurers to cover all of these benefits. So it'll depend on where you live. It'll be very unequal coverage. One of the other major changes is to really overhaul Medicaid. The Republican bill will eliminate funding for Medicaid expansion. It's likely that as people fall out of the program, states are not going to sign up new people. But even more so, and I don't think a lot of people recognize this, it would actually fundamentally change the traditional Medicaid program, which now covers more than 70 million people. That's about 1 in 5 Americans are under Medicaid, and it is going to change that program radically. The Congressional Budget Office expects that federal support for Medicaid would be cut by 25% by 2026. That is going to be huge. And the states are going to have to deal with this lower funding from the federal government. So they're going to have to curtail benefits, curtail eligibility. So there are going to be a lot fewer people on Medicaid. One of the most hated parts of Obamacare is the individual mandate. That is going to go away. So you will no longer be required to get coverage or pay a penalty. Employers who have more than 50 workers are also required to provide affordable coverage for their workers. That also goes away under the Republican plan. There were a lot of taxes associated with Obamacare to help pay for it. All of these go away. Under Obamacare, there was an historic drop in the uninsured rate in America. That's very important to note. And under the Republican plan, it's very likely that that number is going to be reversed.